Hello, my name is Caitlin Johnson, and this is my Business and Healthcare Analytics presentation. My hypothesis states, as the average time patients spend in the emergency department before they're admitted to the hospital as an inpatient decreased, satisfaction of care increased. This was proven through my research, and this is how it started. First was the exploring section. I came up with two research questions. They were, how is the timeliness of care related to patient satisfaction, and how are complications related to patient satisfaction? I then chose variables based off of these research questions. I chose 5 from the category timeliness of care. The first include average time patients spend in the emergency department before they were admitted to the hospital as an inpatient. Second, average time patients spend in the emergency department after the doctor decided to admit them as an inpatient before leaving the emergency department for their inpatient room. Third, average time patients spend in the emergency department before they were seen by a healthcare professional. Fourth, percentage of patients who left the emergency department before being seen. And lastly, patients who developed a blood clot while in the hospital who did not get treatment that could have been prevented. In the next category, complications, I had 4 variables. First were safety factors, pressure ulcer rate, inpatient surgical deaths, and accidental puncture or laceration for medical treatment. Lastly, in the patient satisfaction category, I had 6 variables. These variables were represented by a 0 or 1, 0 being not satisfied and 1 being satisfied. These included care transition, average communication between doctor, medical staff, and nurses, hospital recommendation, discharge, cleanliness, and staff responsiveness. Next, we have the univariate analysis. The average time patients spend in the emergency department before admission represents the average time patients spend in the emergency department before they're admitted to the hospital as an inpatient. The average time was 273 minutes with a median of 256. The data shows a normal distribution curve. However, to make the data more representative of the average hospital in the United States and to make the data cleaner for statistical purposes, I excluded the outliers that were less than or equal to 700. The lower bound was 60 and the upper bound was 700. The satisfaction of care on the right represents how satisfied patients were with their provider transitioning them to different care settings. The mean was 81 with a median of 82. This dataset also showed a normal distribution curve with a lower bound of 67 and an upper bound of 99. When I compared the two variables using the bivariate analysis, I had to cut out the outliers for the average time that were less than or equal to 700 since I did that as well in the univariate section. This data shows a deep downward slope. As a review, my hypothesis states that as the average time patients spend in the emergency department before they were admitted to the hospital as inpatient decreased, satisfaction of care transition increased. However, the main reason I chose to test this is because obviously my hypothesis, but this is important because staff plays a large role in how the admittance process flows. It also has a big factor on who returns to the hospital for future/follow-up care. The independent variables is the average time patients spend in the emergency department before they're admitted to the hospital as inpatient with outliers less than or equal to 700. The dependent variables include the satisfaction of care transition. And the control variables included bed size, accreditation, payer mix, CBSA, region, and owner. There was a tremendous number of observations, being 3,166. There is confidence that when the average time patients spend in the emergency department before they were admitted to the hospital as inpatient decrease, satisfaction of care increases. Since the p-value was less than 0.05, approximately 27% of the variation of satisfaction of care transition can be accounted for by the average time patients spend in the emergency department before they're admitted to the hospital as an inpatient and by the control variables listed above. Since the average time patients spend in the emergency department before they're admitted to the hospital as an inpatient's p-value is less than 0.05, each time it goes up by 1, the care transition satisfaction is nearly 0, meaning not satisfied. Therefore, the hypothesis is correct. It is noted that rural hospitals have a greater satisfaction than the micro and divis. Also, for-profit hospitals have the lowest satisfaction out of the owners. The North Central region has the highest satisfaction, with the South Central region in second, with lower time spent in the emergency department. Therefore, I came up with my policy, which is a 5% pay increase to emergency department staff that can decrease the average time patients spend in the emergency department before being admitted to the hospital as inpatient by half. To experiment this policy, I would have a micro hospital's emergency department run the test first. This is because I recognize that rural hospitals have the highest satisfaction and want to see if the policy is put into place at micro hospitals, if it will actually work. Tests will start in May and run to the end of July, and use every patient that time period as study participants. I would gather the data that states the average time patients spend in the emergency department before they're admitted to the hospital as an inpatient. Then I would hold a conference or meeting with staff and bring forth the policy and how it will be implemented. This policy would also include ambulatory staff, which sometimes are overlooked. The main objective the department should do is focus on the idea to change the staff culture by placing the patient first. The culture of an organization has a lot to do with how it performs and what the staff and patients expect to get out of the organization. Therefore, the first goal is to make sure there is a positive culture of change and efficiency. To make a positive culture, staff must be willing to be held accountable for their actions and communicate effectively to other patients and staff members about what the patient needs and wants. There will also be a leadership team, and their goal is to hold employees and staff accountable for putting the patient first. These teams will meet weekly along with the rest of the staff to discuss and report any changes or areas of improvement in the system. Next, there will be a well-known mission statement so everyone in the hospital is aware of what's going on and what needs to happen to get the desired outcome. The leadership team will be responsible for providing system resources, motivating team members, and managing conflict efficiently. The leadership team will consist of both admin, doctors, and nurses to help support the entire department. Best practices will be put into use to minimize the time that patients spend in the emergency department. This includes the transfer of admitted patients to inpatient within 20 to 30 minutes of the nurse's report. It will also include decreasing the time in the emergency department by using discharge planning activities. One thing that may be overlooked includes staff responsibilities. Some staff may be overlapping in their responsibilities, while some may have gaps, thus resulting in unclear accountability, poor communication, delay of care, and in some cases, even medical errors. Due to this fault, there can be a positive change, which is defining and clarifying staff roles to the employees. However, using a team-like approach will help the department succeed for the system and the patients. The funding that is necessary to implement this policy is only when it is carried out correctly, which is when the staff decreases the average time patients spend in the emergency department before being admitted to the hospital as inpatient by half. This money that would give the staff a 5% increase would come from the American Hospital Association, whom I would hope would help implement it, and since it is such a large issue in hospitals today. By improving department flow, the hospitals can operate at an increasing volume while the quality of care and satisfaction improves with minimal additional funding and by using the same amount of space and staffing. These new changes will allow for more accountability and better communication that will allow the emergency department to manage in new and exciting ways.